The testimonies call the treatment nothing short of a miracle.
Without this program and without people in place, such as Tamia, I do not know where I would be today.
Treatment Centers XL, also known as AminoKit Laboratories, offers a list of drug and alcohol withdrawal and addiction programs. The most innovative, amino acid intravenous and oral therapy to combat the disease of addiction. Treatment Centers XL operates here in the Conifer building of the Skyridge Medical Center. A professional-looking website and an office right at the hospital sold Katrina Fulmer on the program.
I thought, well, why not Skyridge? It's 30 minutes from my house. It is at Skyridge Hospital, and I bet people come from all over the country to come to this place for a treatment center, and it's in my own backyard. How lucky am I?
Fulmer came to Treatment Centers XL last year to withdraw from an antipsychotic called Zyprexa. She says she signed up for the IV bags and what she calls an inpatient program with the supervisor at a cost of more than $16,720.
And I put my life in their hands, and they screwed me.
Fulmer says during one of the IV treatments, she had an allergic reaction.
I was very flushed, and my skin just turned bright red. It wasn't just red, it was like I had welts across my skin.
She says managing her IV treatments and providing medication was this woman.
Hello, my name is Tamia Cisco. I am a certified addictionologist.
Except the state says she's not a licensed addiction counselor, nor does she have a medical license. In fact, in 2007, the state pulled her chiropractor's license in part because they said her administering IV treatments was outside of her scope.
But Cisco continued to treat patients. In 2008, Denver District Court banned her from practicing medicine. Cisco promised she'd stop. But more than 7 years later, she tried to treat Katrina Fulmer. She's now suing, and attorney Jay Reinen is representing her.
They take advantage of vulnerable people.
All the patients get acupuncture.
We haven't been able to arrange an on-camera interview with Cisco. A spokesman called much of Fulmer's lawsuit speculative and said when the court reviews those things, they will not feel they are factual. But Cisco has caught the attention of regulators again. Colorado's Attorney General, the State Board of Medical Examiners, and the State Board of Chiropractic Examiners are asking a Denver District Court to throw her in jail. The agencies have filed a contempt of court case saying Cisco refers to herself as a doctor, dresses in a white doctor's coat, and administers, inserts, and monitors intravenous treatments. The state says these photos are proof.
She's in existence because the state's not doing their job.
There could be waiting for getting new information. It could be other proceedings that impact pursuing the action.
Ronnie Hines is the deputy director of the Department of Regulatory Agencies. She says it's their job to stop people from posing as medical doctors. But if you go to an unlicensed practitioner, that's your fault.
Take a few minutes, get online, make sure that you use the resources available to you to know that someone's licensed.
Fulmer says the last 16 months or so have been difficult.
Pain like this breaks your heart open, but I think it strengthens you.
She says there's only one way for her to heal and for the state to protect others.
I want them closed down and done.
Cisco spokesman said Cisco is primarily an administrator and her staff handles the actual patient care. He said her attorneys believe she's acting within the law and will be exonerated in both Fulmer's lawsuit and the state's court case. In a response to Fulmer's lawsuit, Cisco's attorneys said Fulmer voluntarily assumed a known unreasonable risk.
So rightly or wrongly, Whitney, some people may associate her with Skyridge. What is Skyridge saying about this?
So they say that they are not affiliated, which is why we felt like it was so important to do this story. Just because someone leases property at a medical facility, at a hospital, for example, does not mean that they have a medical license. And that is why it's so important to double check that.
You wouldn't always think that if you walk into a hospital property.
Right,
yeah.
right,
Exactly.
right, and a lot of people do. And so, again, the Department of Regulatory Agencies says the onus really falls on the patient. Even though it might be difficult, it's important to go online, verify that your doctor actually does have a license, because again, location is not verification. So, and that was abundantly clear in this case.
Very interesting. Whitney, thank you.
You bet.